Hi, my name's Dr. Jeff Williams, Director of the Invasive Cardiac Electrophysiology Program and Heart Rhythm Center of the Good Samaritan Hospital and Lebanon Cardiology Associates. This is Lecture 5, What to Expect on the Day of Pacemaker Implant Procedure. The objectives of this lecture are to be able to describe the events that take place on the day of pacemaker implantation. Registration and check-in. Patients generally undergo pacemaker implantation at a hospital and stay overnight. Patients will check in at hospital registration and proceed to the holding area or preoperative unit. They will change into a gown, hospital documentation will begin, and IVs will be started. The informed consent process is used to ensure that the patient understands the nature and purpose of the pacemaker, as well as the risks, benefits, and any alternatives of the procedure. The patient is then brought to the procedure or operating room. The procedure or operating room may be a standard operating room or a specialized cardiac catheterization lab that has been designed for device implantation. The picture shows a dedicated implant procedure room that includes X-ray equipment to permit lead placement, screens displaying patient information, anesthesia equipment, equipment to program the newly implanted pacemaker, and the patient table. The implant procedure begins with sterile preparation and draping of the patient on the operating table. Patient is then sedated. Specialized personnel prepare the implant area under the right or left collarbone and cover the rest of the patient with sterile gowns. The implanting physician sterilely scrubs hands for several minutes, then puts on sterile gown and gloves. Lidocaine is used to numb the skin, and a 1 to 3 inch incision is made. Device pocket is made under the skin but above the chest wall muscle, usually. This pocket will hold the pacemaker and any extra lead material. The subclavian or axillary veins are then punctured with a needle, and a wire is placed through this needle. The needle is withdrawn, leaving the wire in the vein. Over this wire, a hollow tube is placed, and the pacemaker lead is placed through this hollow tube. Once the lead is attached to the heart, the hollow tube is removed, and the lead is sewn in place to the chest wall muscle. This is repeated for each pacemaker lead. The pacemaker is then placed into the pocket with the leads coiled underneath. The incision is then closed with several layers of sutures. The top layer of skin may be closed with staples or steri-strips or butterfly sutures. A sterile dressing is then placed over the incision, and the patient is awakened from sedation and returned to the recovery area. Immediate post-implant, the patient is usually observed overnight in the hospital. In our Heart Rhythm Center, patients are kept lying in bed for 4 hours and then allowed to eat if they have recovered from the sedatives. Some centers may perform a chest X-ray immediately after the procedure and/or the morning after. This chest X-ray is used to verify correct lead position and assess for any complications. The day after the pacemaker implantation, a chest X-ray is performed to reassess lead position and evaluate for any complications. The pacemaker is usually checked or interrogated with a special computer to make sure leads and pacemaker are programmed and functioning correctly. Want to learn more? What is a Pacemaker? A Cardiologist Guide for Patients and Care Providers is available in print and electronic versions at Amazon.com. More lectures can be seen at heart-rhythm-center.com. Thanks for listening.